Hello, I am Cindy Gaines, and I'm the Chief Nursing Officer and Clinical Lead for Population Health with Philips. And I am so pleased today to be here with Dr. Ray Costantini. He is my colleague he's the co-founder and CEO of Bright MD. And we're going to have a conversation today about how digital and telehealth has shifted amid the COVID-19. And what we kind of see is what lies ahead for telehealth and virtual health. So before we get started, we want to just tell you a little bit about each of us. And I hope you don't mind, Ray, but girls get to go first. So I'm going to go first.
Perfect.
I'll hand it to
Absolutely.
You. Okay. So I am a nurse by background. I've been a nurse for over 30 years, and I've been in leadership for the last 25 of that. I've split my time between inpatient and outpatient and quality and operations. And I've spent the majority of my healthcare career in the health system side of the world. I most recently served as the vice president responsible for population health and really created the foundation and stood up the population health approach with my health system, and then went on to serve as the president of the medical group. I've been with Philips about a year and a half and came in to bring my experience and my expertise to the population health solutions, and I'm really thrilled to be here today. So how about you, Ray? What can you tell us about yourself?
I think that you overshadow me, Cindy. It's a pleasure to be able to get connected with you. Thanks for the chance to be able to talk. Quick background on me. I am a physician, also an entrepreneur, and a couple of different rounds through this now. In the middle of that, I actually also built and led the digital health services group with a large West Coast healthcare delivery system. And that was really the first time that I had the opportunity to really see firsthand both the opportunities and the promise of digital health really in application, and seeing all of the needs that healthcare delivery systems and providers and patients have, and see the opportunities that are out there from the expanding set of digital tools. And that was a dozen years ago now that I started. So that was back when digital health was relatively nascent.
Yeah.
I'm now the co-founder and CEO at Bright MD, and Bright MD really combines asynchronous telehealth with care automation. So that means that we can make it so that a single nurse practitioner or a physician can actually easily provide high quality healthcare for more than 200 visits in a single 8-hour shift. So very different and expanded beyond just the removal of geography, which is what you get from telehealth. It really is that application of care automation on top of it, to really bring that efficiency, quality, thoroughness, consistency that really drives that quadruple aim value for everybody involved. So
that's awesome. So, we've just been hearing so much about telehealth and virtual care in the news and with COVID, and we're not surprised. I mean, we're hearing the press are using words like explosion and revolution. And when you look at the numbers, they're pretty staggering. If you look at prior to COVID, 10 to 15% of health systems were doing some form of telehealth or virtual care. And with the onset of COVID and the need to reach out to patients, 75% are now using some form of it. But so we went from kind of dipping our toes in the water to, I think, diving in head first. And so we can use an explosion of the use of it, but it's now time to say, okay, so now what? How does this change what we do every day? How does this really change what we're doing in healthcare? And I was on a panel with you recently, and I used the word as home as another setting of care. You really appropriately kind of challenged that. It's more than just another place of care. This is really about a new care model. And so, which is really that virtual front door. So I'd love for you to just talk a little bit more about what you meant by that, and where do you think that's going?
Absolutely. I mean, I think that it is really rethinking how we consider where care can get delivered, and even more importantly, how care can get delivered. And I agree with you that virtual front door is a key piece of it. One of the interesting things that we see a lot when we talk with health systems is that when you talk about a virtual front door, sometimes health systems still think about that as a virtual front door that gives you easier access to bricks and mortar healthcare. And I think that is a piece of it, because I think that making that seamless connection between clicks and bricks is a really important part of how care is going to be delivered for a long time. but you really have to, I think health systems, providers have to be thinking differently. They have to be thinking more broadly than that. You have to be thinking about it not as telehealth versus in-person care, but what is that continuum? How do you use these tools in ways that really connect the experience of care regardless of where the patient is at? As their needs continue to evolve, even in a single visit, you need to be able to make those shifts, get the patient to where they need to be, help them navigate through the complicated process of healthcare, and give them the consumer-ready experience that they have increasingly expected and they certainly deserve. So to me, I think that that's pretty foundational to where we need to be going, and that means not only changing the tools that we use to deliver the care, but again, changing those business models, thinking about how healthcare can be doing things differently and better for their patients.
Yeah, it kind of reminds me of when we went up on electronic medical records. It wasn't about taking that paper form and just building it in the electronic medical record, because that didn't work then. It was really thinking about that workflow and how do we do it differently. And I think that's the challenge we have again that we need to be thinking through. So
one side note on that one.
Yeah,
I hope we can do it. I hope we can do it better than EMRs, because arguably EMRs were not built around workflow. EMRs were built around optimization of billing, which was an important piece of what needed to happen in healthcare, and it built that really strong foundation. But let's do better than we did with EMRs on the experience side of things.
Are you peeking at my notes? I think you're peeking at my notes, because I have to say, I'm like, technology has changed the way the providers and the patients interact. And
Yes.
There's been so much focus on the technology, but I think there's been a huge focus on the technology from the ease of the patient. And, we have an aging population. Can they use the technology? And I think they've kind of shown themselves pretty adaptable during COVID. I think they proved that they can do the technology with some coaching. But I feel like the provider's gotten a little lost in that technology. They're overwhelmed with documentation. And you're absolutely right. It's about billing, it's about legal coverage, it's in multiple platforms. How do we make sure that technology is an enabler and not a barrier to the patient?
Yeah, I think it needs to go on both sides. I think so. The interesting thing is that this is the job of good technology, is to truly solve the problems that the users are experiencing. And I mean, again, I didn't mean to be stealing from your notes there, but I do think that EMRs have arguably not, they did exactly what we asked them to do.
Yeah,
which was not to be able to improve that experience of care for providers or for patients. It was really around how do we better codify this information and document it in a way that can optimize billing and give us that outcome. I think now we're in a post-EMR landscape where our job is to be able to, now that we've got that data that's there in digital form, how do we use that in a more productive, high value way that actually improves clinical outcomes, improves experience? We have to understand those patients' needs. We have to be looking outside of healthcare, particularly on the consumer side of things, and go, what is it that patients are healthcare consumers? They're a special kind of healthcare consumer, which is why we call them patients, but it's important to remember that they are consumers of healthcare services, and we need to be thinking about that. So we need to understand outside of healthcare, how have their expectations been set, and then make sure that we're delivering on that inside of this industry that's so critical for everybody. I mean, in the end, everyone becomes a patient. And on the healthcare deliveries, what's that?
Oh, I was just agreeing with you that they absolutely do.
Yeah. And then on the healthcare side, on the provider side, I think it's understanding what they're trying to do. I mean, they are arguably in the best position to make the patient experience better. And we need to give them the tools that make their jobs easier, not harder. We need to really be thinking about their workflows. Instead of having them hunt through 16 tabs and do 120 clicks in order to be able to complete a visit, we need to be able to give them what they need. We don't, providers spend 70+% of their time really doing documentation and order entry and gathering information from multiple sources, having to hunt through multiple sources of information to get what they need, when really we should be helping them practice closer to the top of license so that they've got more time on the high value things that that make a difference to the patients that they serve. So
Absolutely. And I think the challenge for, that I think of being on the solution side of the world, I think we have to start thinking about how to make our solutions speak to one another and work together so that the providers aren't having to go into multiple systems to care for the patient. It really, one of the number one complaints I'd have is my providers looking at their computer, looking down, and I need them to be looking at me and connecting with me. But when you say clicks, you're right, they're counting how many clicks, and every click's a burden. And so I think our challenge as solution leaders is how do we start to play across our solutions and have them work together as opposed to the providers in and out of each one separately. So really
yeah,
looking at that ecosystem.
I think you're
So,
right, and
but
I appreciate that word. Ecosystem is really it. It's more than just connectivity or even interoperability. It is thinking about how do you get information both to and from where it belongs to help those clinicians best help their patients. So yeah, I think you're completely right. I'm going to steal that word from you.
oh, please do, please do. So do you think, the provider-patient relationship has changed in this from that traditional relation? Has it, when you think about taking care of a patient in their home and engaging them in a different way, the word partner starts to come to mind, and that's a very different way of looking at a patient. What are your thoughts, and does that change?
I think that that has been changing for a while. I mean, I think
Mhm.
that if you look at the even the expectations among different age-based demographic groups, the relationship that they expect from their provider is different. I think the democratization of information has changed the power differential. I mean, if you went back 50 years ago, you went into the doctor to be told what to do. I can tell you, I had plenty of patients coming in with a pretty well-founded sense of what they wanted to have happen in their visit when I was practicing. And so that power differential had already shrunk from a lot of different dynamics. And as healthcare has continued to become more accessible, as new entrant competitors have come in and done a better job than traditional healthcare in meeting patients where they're at and where they want to be and getting care in the way that they want, I think that that set a different expectation for
Mhm.
everyone across the entire industry. So yeah, absolutely. I think on multiple different fronts, it's been changing for a while, and I think
Mhm.
that this global pandemic has definitely poured some accelerant onto that process. I think the patient's eyes are wider open to the different possibilities and what a relationship can look like. So
Yeah.
yeah.
So, the feedback from providers and from patients is they don't want this to go away. They do like this new connection. But as we start to look in that future, and you mentioned it, we built our world on bricks and mortars. So it is introducing something so new and so very quickly. What's the mind shift do you think we need to make in order to be successful in this kind of new approach? If an organization's wanting to go there, and we know they do, what do they need to really, how do they need to think differently?
I think there's a number of different ways for that health systems and providers need to be thinking about it differently. The first one is I think we need to stop putting these different venues of care into distinct boxes. We kind of alluded
Mhm.
to this earlier. I mean, in the end, telehealth isn't a new thing that healthcare is offering
Mhm.
to patients. It's a new way of getting the same thing. I mean, if I put on a business hat for a minute, telehealth, you're as a patient, you're buying the same experience, the same process. You're getting evaluation and diagnosis and treatment. It's it's via a different tool. But
Yeah.
really, we need to stop thinking about telehealth isn't a new service line any more than a telephone is a new a clinical service line. I mean, it's a video connection's a fancy telephone where I can get additional
Mhm.
information through it. And we need to start thinking about it across those modalities. You know, it's
Yeah.
what's the right way to be able to meet this patient's needs in this specific circumstance. And that may start in an asynchronous setting and where I can gather a lot of information and streamline that process. And then it could escalate to a video encounter. And then they may have follow-up needs that actually need to be happening in a bricks and mortar setting where there are labs or diagnostics or imaging that need to happen. It's that seamless connectivity that is what solves the patient's problem. Their problem is that they're scared or sick or both. And we need to help them navigate that complicated process of healthcare, regardless of where they start, and get them all the way through in as seamless a way as possible. And that is truly thinking about digital not as a standalone, but as the really as the foundations that help, the underpinnings that help connect all of those pieces together. It's not getting care digitally or getting care in person. It's how do we use digital to provide care across the continuum, clicks or bricks. And then go ahead.
I was gonna say, we've kind of artificially siloed our world in health systems. You know, there's inpatient and then there's outpatient and there's, you know, there's all the different codes we use. And you're really talking about, we become really that, and the patients function in those silos. So how do we connect them? And that's where I always say, let's eliminate the word discharge. Going home is just another transition of care. We're transitioning to your home, and but we're going to continue to care for you. It stops being episodic. So, but it is connecting those. I love when you were describing that. That's what made me think about. So
I think you're completely right. I mean, I think the interesting thing is that, especially as we continue to make these shifts from fee-for-service into value-based care, we're also going to need more frequent touches. And in order to be able to control costs, we need to be doing them at a lower price point in order to be able to do a lower cost point. And so using digital tools to be able to facilitate that. Even my sickest patients, when they're outpatient, I mean, I see them maybe less than, I mean, if somebody who's really sick, I see them 1% of their time. And so the ability to be able to do that, whether it's through remote monitoring, whether it's through in tools that let them connect with the provider in a better way, whether it's tools that help them get into their and know when to come into a bricks and mortar setting, all of those. You're right. It's less about silos and more about seamlessness.
So we need to bring, this has been a great conversation. I think we could talk for hours on this, but we do need to bring it to a close. Any key takeaways for the audience that you'd like to share? Any words of advice?
Oh my goodness. Think boldly. I think healthcare has had the luxury of being a relatively stable landscape, of operating in a relatively stable landscape. And that's not the case anymore. And settling for table stakes, doing something because everybody else has done it, and you're like, well, gosh, we got to do this in order to keep up. That will not position health systems to be the leaders that they have been and need to be in the future. And if they don't think and act boldly and distinctly, then there will be new entrant competitors that will be coming in. I mean, the Teladoc Livongo merger is fascinating. I mean, that is combining episodic remote care and long-term chronic disease management, and they're going to market directly to health systems with an offering that will be competing in a much different way with traditional healthcare delivery systems. And that's just one example.
Those disruptors are making that we have to become bold. And I would put along with your be bold is to fail early and fail often. Don't be afraid of failure. It's the way to learn and adjust and keep going. It doesn't mean stop. And that we should not be afraid of failure. I mean, I think that's how we have the light bulb today. I don't know how many times Edison failed, but it was often. So thank you so much, Ray, for your time. And it's been a pleasure to see you again and spend some time chatting.
You as well, Cindy. Thanks so much for the invitation and the chance to be able to chat again. Really enjoyable.
Thank you.